One, just to make sure we're all clear, talk about plant fats, meaning raw seeds, raw nuts, avocados, and olives. To make sure we're clear on that. I know Dr. Fuhrman covered this during his individual lecture, but let's hear it again here. Two, what do you do when someone comes to you and says, I have gastrointestinal problems, it hurts, everything bothers my stomach? Number three, what do you think about fermented foods such as raw sauerkraut? And number four, what are food deserts and why do we have poor people having such bad health outcomes? And what are we doing as a society that's setting it up that people are having such poor access to healthy foods and healthy information? And we're subjecting parts of the population who are poor to guaranteed fast food, high fructose, low quality food that's leading to disastrous health results. Dr. Fuhrman wrote a book, Fast Food Genocide. Dr. Williams is passionate about this. So we'd like to hear about that too. So those four questions, if you guys could wrap up with.
So maybe I could start, since healthcare disparities is pretty much what I do all day, every day. And I'm glad that Dr. Fuhrman has pointed it out. There are more fast food restaurants and smaller, healthy grocery stores with relatively poor produce. I know I don't generally mention any brands or anything, but there is a movie about this, if people like it. It's about the African-American community called Invisible Vegan, that just outlines all of these issues of food deserts and having to go far away. I do know that, again, I'm not going to mention any brand names, but there is one food chain that I know that everyone is familiar with that's gone into the Inglewood neighborhood and went into Midtown Detroit when I was there. And that, and they changed their pricing structure that everyone used to joke about, and they made it affordable for the inner city people. And that, if that continues, we can get rid of these food deserts and the dependence on fast foods. So two other things that I'd like to say. Number one is, our government actually spends billions of dollars per year on subsidizing foods or food substances such as high fructose corn syrup and refined flour. And I won't mention a brand, but there's a very popular pastry thing with a catchy name that has 14 different compounds that are food subsidized. That makes it very inexpensive. That makes it affordable for people who are socioeconomically deprived. This really has to end. And I just don't see how we can do this without legislation. The next issue that's more social political is the fact that we don't have the education systems to try and get people the health literacy that they need to make better food choices. There are some places that have gone to a red, yellow, green type of sticker system on foods in their stores. It may make their store really unpopular, but I think that's something that could go a long way, along with the FDA insisting on new labeling to try and get people to understand cholesterol, saturated fat, and sodium. And then the last thing is that my granddaughter, believe it or not, helped me with a project. I was just amazed at the marketing on television. And I was sitting with her and I said, would you mind just watching a bunch of these and writing them down? Now, it turns out that this was on the heels of that article from JACC that talked about healthy versus unhealthy plant-based diet. Part of that article was actually coming up with a scoring system, which I gave to her and said, and so she watched 100 commercials and she scored them all. And the scoring was absolutely atrocious. And the largest negative scores of things that are being marketed were at the fast food restaurants or the fast food, and these franchises. And it turns out that with COVID, they stopped marketing things like airline tickets and rent-a-cars. And they started changing to more food substances, more unhealthy food substances. So that COVID-15 that people talk about, that's going to be with us for a while. That's going to play out in cardiovascular events if we don't get this turned around. So anyway, I'm going to back. That's the last part that I would talk about, is that it is enhancing our cardiovascular disparities to have these kinds of food substances inundating our communities through marketing.
Joel Kahn is jumping in. I won't speak more about disparities because Dr. Williams is the expert. Fermented foods, 2 thumbs up, but I like to keep it real and simple, and not everybody likes sauerkrauts and can do that. Whole food fats, nuts, olives, avocados. I teach my patients they're fine not to run away. Most of the scientific data supports that, even in the cardiovascular world, though much of it is actually funded by the avocado industry and the olive industry, but we get the science we get, and we hope it's clean. And I think that was it.
Gastrointestinal issues.
Yeah, gastrointestinal is tough. I mean, go slow. Most people can tolerate whole food plant-based diets if they'll just slowly make the transition, and some people can do it overnight. But there is that frustrating group that just does not feel well, and they get wooed back to adding a little animal product back in. But hopefully we can keep them in the realm of 90% plus. Well, a lot of us do 100% plant-based.
All right, maybe I'll just add 2 points. One is that I have to say that in looking at the hundreds of studies on nuts and seeds and longevity, cardiovascular death, mortality, and cancer death, that the corroboration between those studies, even if you isolate every one not funded by the nut industry, and most have not been funded by the nut industry, and the corroboration between one study and another is amazing at the degree of consistency among studies to show that these whole food plant-based fats increase lifespan and reduce all-cause mortality, including cancer mortality and cardiovascular mortality. So it's unquestionable that the science that shows that nuts and seeds are a valid addition to the human diet, and even for people with heart disease, most likely taking nuts and seeds out of the diet increases the risk of arrhythmia, sudden cardiac death, and is harmful to them compared to a diet that includes the judicious use of some healthy plant fats like walnuts and hemp seeds. And I think there's a significant amount of evidence that demonstrates that. So number one, there's a false fear that fat is evil and fat's the bad guy. And by the advantage of a vegan or plant-based diet is that it's low in fat. No, it's not true. And it's that there's different levels of fat that are acceptable. And of course, we want to continue to recognize the context that body fat is dangerous, and because nuts and seeds are concentrated calories, you can overeat them and you could prevent fat loss, and then that would make the diet unfavorable. But as long as you're moderating your overall calories and you're keeping that within a reasonable framework and you're losing weight and achieving an ideal weight, the nuts and seeds are a wholesome part of a cardioprotective and cardiovascular diet, and there's no data to suggest that that's not true. As far as my comments on food deserts, is that over the years, I really think that we've got to get into reading, writing, arithmetic, and nutritional science as the 4 basic subjects taught in grade schools across the country. That's the most critical knowledge that affects our future, is what we eat and what and we have these programs against smoking and against using drugs and against cocaine and saying no to drugs. And we try to indoctrinate our children against becoming drug addicts, but we allow them to become food addicts at the same time. And we support them in our food addiction, and the food and the teachers with the parties and the soccer games and bringing donuts and the support of Halloween and all the celebration around junk food and candy really doesn't respect the fact that eating sweets and candy and commercial baked goods reduces intelligence, creativity, educational achievement, economic opportunity, and is even linked to criminal behavior, and that in the highest quintile of consumption of candy in childhood, where people are consuming candy almost daily, have higher risks of criminality and drug abuse later on in life. It's almost like sugar and candy and fast food is the gateway drug to more serious offenses. And we've got to start to put more emphasis into primary education. People say to me, oh, doctors got to learn more about nutrition. And I'm saying, you don't wait to go to a doctor with medical problems at the age of 50 to expect to change your nutrition then, which your whole life of nutrition affects your health and longevity. And we've got to get to people at all ages of life, including right from the start in kindergarten and grade school, and get nutritional education in part of the whole educational process throughout a whole person's educational career. So that's what, it's not going to necessarily happen. There's so much social and negativity, and the political climate in this country is so bad for the climate and bad for future health, or has been. And now we're obviously, hopefully things will change. But even still, there's so much that has to be done differently, and us together, I think, are all fighters and all passionate about changing society and changing America and encouraging people to eat a healthier diet.
If you would each make a 15-second to 20-second closing statement of anything you want to leave us, any final thoughts you want to leave us with.
I'll jump in. I think the greatest secret in medicine is the body has the ability to prevent disease in the first place, let alone to heal disease if present. Thank you.
Thanks, Joel. I would say that the body is a miraculous self-healing machine. And when you optimize the environment for healing, it's incredibly remarkable what can achieved. And diseases that are considered not reversible, including things like asthma and allergies and psoriasis, and these things that fibromyalgia are reversible. And watching people get well is possible with nutritional excellence and predictable.
So thank you so much for having me. I just want to, sort of add my 2 cents in that we have, we're living in a pandemic twice over, and people are dying from this preferentially because of nutrition factors. That is, the people who get COVID and recover tend to have the healthier microbiome. The people who get COVID and end up hospitalized, ventilated, and dying are the ones who have all of the risk factors that happen from nutrition. That's high cholesterol, hypertension, diabetes, obesity. And so if I had 15 seconds to reach out to everyone in the middle of this dual pandemic, I would say, please, today is the day. You've heard this entire healthcare conference talking about nutrition. Realize that it's the fundamental that can save your life, your family's life, your community, and this country. Thank you.
And could each of you just quickly tell everyone how to get in touch with you, follow up with you, buy your books? Like how do they stay in touch with you?
I have no books or anything like that. If you go on the Rush website, I know I did open my mouth and say I see people online, which is true since COVID. But Rush told me, no, you can't see anybody who's not in a state where you're licensed. So Illinois and Michigan, it'll work out fine. And it's funny how Rush advertises me at Rush Oak Park, which I'm there, a couple times a month. But if you get to there, you'll get to the entire system. And I'm happy to see people who are in either live or in Michiganders or Illinois.
Joel Kahn, suburban Detroit. I have an active practice. And I have licenses in lots of states. So I invite people to come to see me, but I'm able to do some telehealth too. Thank you.
And if people want to find me, obviously, and get more information about my services, it's drfuhrman.com. And I also answer people's questions and forums on the website that they could as well. So of course, I spent a lot of time developing delicious recipes and menus to make this so people can use this practically and apply it in their lives if they have diabetes or whatever. So in other words, I'm spending a lot of my time and myself and my staff developing recipes and dietary menus for people to apply this and make it work.